Chapter 23, Therapeutic Agents for the Renal System. As always, I will skip past these terms and definitions, but we'll cover them through the chapter. We have our common drugs for conditions of the renal and urinary systems. As always, great to practice the pronunciations of the generic medication names. The kidneys are the major organs of the renal and urinary systems. The kidney maintains the chemical composition of electrolytes, fluids, and tissues in the body. This includes acid-base balance, preservation of normal blood pressure, and production of hormones such as the active form of vitamin D, renin, and erythropoietin. The kidneys are inside the upper abdominal cavity with one kidney on each side of the vertebral column. The right kidney is a little lower than the left because the liver is directly above it. The kidney filters blood as it enters the kidneys at the hilus from the renal artery and reabsorbs important ions such as sodium and chloride. The renal vein and ureter leave the kidney at the hilus. The renal vein returns blood to the body after the kidney filters it. The ureters carry waste removed from the body to the bladder, which stores the waste for excretion as urine. Figure 23.1 is the anatomy of the urinary tract and nephrons, and figure 23.2 is the structure of the kidney. So you can see here is the ureter. The bladder resembles a holding tank that can expand depending on the volume of urine it contains. When it becomes full, we feel the urge to urinate. The body eliminates urine through the urethra, a short tube leading from the bladder to the outside. The kidneys play a crucial role in regulating many bodily processes. The body is constantly developing waste products as byproducts of normal metabolism by active tissues and from digesting food. Ultimately, the kidney filters the blood and removes these wastes. The cleansed blood and other vital components, such as proteins, return to the body. Waste products filtered out of the blood by the kidneys enter the urinary system to be excreted in urine. Excretion is one of the four major important pharmacokinetic, which is drug movement or body functions. The four functions are absorption, the intake of liquids, solids, and gases into the body; distribution, the way in which chemicals, nutrients, and drugs move throughout the body to their targeted organs and tissues; metabolism, the chemical changes and reactions in the body system. Metabolism includes anabolism, which is building up processes, and catabolism, which is breaking down processes. Excretion, the elimination of chemicals and substances from the body. Normal urinary output for an adult is 1 to 2 liters a day. The liver produces urea that ends up in the urine. Urea is a form of nitrogen that the body converts to ammonia, which causes the characteristic urine smell. Another important kidney function is balancing fluid and electrolytes. If electrolyte concentrations fall out of balance because the kidneys cannot filter appropriately, conditions such as metabolic acidosis or alkalosis can develop. Acidosis is an excess of free hydrogen ions in the body fluids. Alkalosis is the retention of bicarbonate or excessive loss of hydrogen ions. Although the kidneys are only about fist size, they filter about 45 gallons of blood a day. The functional unit of the kidney is the nephron. It regulates fluids, solids, and waste in the body. Each kidney contains millions of microscopic nephrons, and they actively filter blood 24 hours a day. Figure 23.3 is the nephron anatomy. The renal artery enters the kidney and divides into progressively smaller vessels until it becomes the afferent arterioles. Blood then passes from the afferent arterioles into a cluster of capillaries called the glomerulus. A doubled layer epithelial cup that resembles a baseball glove surrounds each glomerulus. This structure is called the Bowman capsule. Blood cells, platelets, and large proteins cannot pass through glomerular capillaries into the Bowman capsule. Only plasma can. Plasma is mostly water, is the blood liquid component. The Bowman capsule Filtrate travels down the descending tubule, makes a U-turn through the loop of Henle, and returns up the ascending tubule. As a filtrate passes through the nephron tubules, various nutrients, water, and important chemical ions are pulled out of the filtrate and returned to the plasma to be used by the body. At the same time, other ions in the tubules are excreted. The filtrate, now called urine, travels from the nephrons to the collecting ducts. The collecting ducts empty directly into the ureter. The ureter extends from the hilus of each kidney directly to the bladder. The bladder empties the urine into the urethra for elimination. An important nephron function is tubular reabsorption. The nephron-produced filtrate contains water, ions, glucose, and other molecules small enough to pass through the glomerulus. Tubular reabsorption enables the kidneys to carry out another important function, regulation of acid-base balance. Two mechanisms affect ion balance. The first is the exchange of sodium ions from the tubules for hydrogen ions. As sodium accumulates outside of the proximal convoluted tubules, it creates an osmotic gradient, and water molecules move towards the higher sodium concentration to equilibrate the concentration. The water molecule movement is osmosis. The overall effect is a decrease in excreted water. Ion exchange also takes place in the DCT. As sodium ions exit the DCT, they are exchanged for potassium ions. The loop of Henle has a different transportation mechanism called active transport. Instead of ion exchange, there is a one-way uptake of sodium and chloride. These ions return to the circulatory system, and overall the body reabsorbs most renal system sodium. Tubular secretion is another major function throughout the nephrons. The collecting duct secretes various ions, toxins, and water. First, the nephron excretes toxins, water-soluble molecules, and excess or unnecessary chemicals, including some medications. The second secretive function allows the kidneys to regulate the blood pH through urinary acidification. This is why urine has a pH of 4 to 5, whereas blood has a pH of about 7.4. The kidneys produce renin, an enzyme that maintains body water balance. Kidneys maintain homeostasis by balancing electrolyte levels. An understanding of ion function is foundational to understanding the importance of kidney function. So we have cations such as calcium, magnesium, potassium, and sodium. They're all positively charged ions. Calcium helps with bone and teeth formation. Magnesium aids in cardiac and skeletal muscle excitability, enzyme activities, and neurochemical activities. Potassium is necessary for glycogen sugar deposits in the liver to maintain blood sugar levels and skeletal muscles for energy. It aids in nerve impulses and cardiac conduction, and it helps in contraction in skeletal and smooth muscles. Sodium maintains water balance, nerve impulse transmission, and regulation of acid-base balance, and it participates in cellular chemical reactions. Anions, which are negatively charged ions, we have bicarbonate, the most important chemical buffer essential for proper acid-base balance. Chloride, the main anion in the transport of sodium, hydrogen, and potassium, essential to acid-base balance. Phosphate aids as a buffer to balance acid-base regulation in cells. It promotes normal neuromuscular action and participates in carbohydrate metabolism. It is essential for formation and strength of bones and teeth, also needed for many biochemical pathways. Many people live with just one kidney thanks to an efficiency that allows for as little as 20% function for survival. Despite the kidney's resiliency and efficiency, it is important for people to monitor diet closely, medications, and activities to maintain kidney health. In some cases, dialysis or kidney transplantation may be necessary. Other conditions that we have not highlighted can include kidney, ureter, bladder, or urethral blockages or infections. If the bladder retains residual urine, infection can result. Significant water intake helps maintain the system's good health by flushing toxins and unwanted chemicals. Chronic kidney disease is the progressive loss of renal function. Diabetes mellitus and uncontrolled hypertension are the most common causes in the United States. Other potential causes include kidney diseases such as glomerulonephritis, pyelonephritis, and vascular disorders. Kidney function decreases with age, resulting in higher CKD incidence in older individuals. As the kidney ages, it is less able to compensate for fluid imbalances. Table 23.1 lists the stages of chronic kidney disease. 1 being the kidney damage with normal or increased GFR, and stage 5 being end-stage renal disease. Severe hypertension and hyperphosphatemia and anemia are symptoms of that. Anemia manifests in advanced CKD because kidneys produce the hormone erythropoietin. When kidney function declines, less erythropoietin leads to decreased red blood cell production and anemia. Table 23.2 lists select systemic effects of chronic kidney disease. Dialysis is a procedure that removes waste products from the blood of patients with end-stage renal disease. It compensates for a lack of kidney filtration to remove waste products from the blood and balances electrolytes and fluid volume. Hemodialysis requires the patient to visit a clinic or hospital for treatment. A vein shunt is used to connect the patient's bloodstream to the dialysis machine, and the dialysis machine uses a mechanical filtration system to clean a small but steady stream of blood from the patient's body. Peritoneal dialysis is an alternative to hemodialysis. A provider connects the patient's bloodstream to a bag of osmotic solution and implants a catheter plug into the abdominal cavity for administration to remove the dialysate. And here's the different two types of dialysis. Nocturnal hemodialysis allows patients to sleep during treatment. Dialysis is done with a portable peritoneal or hemodialysis machine, 8 to 12 hours nightly. Patients do not have to wait between treatments for toxic buildups, and patients avoid the inconvenient dialysis clinic. If dialysis is done at home, patients must be able to troubleshoot machinery problems. Finally, home health nurses may need to help. So for iron deficiency anemia, we have the medication, which is over the counter, ferrous sulfate. It's elemental iron. Kidney stones are small aggregations of material that form in the kidney and or urinary tract. So this is usually calcium, magnesium, or uric acid salts. Hundreds of thousands of Americans experience a condition known as urolithasis, which is kidney stones, annually. Stones can affect anyone, but are most common in those ages 20 to 55. A first sign of kidney stones is pain during urination. Kidney stones can pass naturally through the urine without treatment. Medical treatment helps with difficult stones. In severe cases, kidney stones can block the urinary tract. We have the medication allopurinol, which is indicated for both kidney stones and gout. We have Urosic K, which is indicated for kidney stones and renal tubular acidosis. Edema is a buildup of body fluid in tissues. Edema can occur in the extremities, the lungs, and other areas. The body normally stores fluids in the blood and interstitial spaces, but some conditions cause fluids to accumulate in other tissues, leading to edema. Two general types of peripheral edema include pitting edema and non-pitting edema. When someone applies pressure, indentations or pitting can occur. This seems to correlate with high salt diets and or heart failure. Non-pitting edema does not leave a skin indentation and proves more difficult to treat due to the underlying cause. Select causes of edema are in box 23.1. You see that I've highlighted the kidney disease, inability of the kidneys to function properly in regulations of fluids. This is due to hypertension, diabetes, or any condition affecting any part of the renal system. So here's a picture of pitting edema. You can see the indentations in the skin. For edema, we have diuretic classes for medications. These include thiazide and thiazide-like agents, loop, potassium sparing, carbonic anhydrase inhibitors, and osmotic. So here are select diuretic medications. For loop diuretics, we have furosemide, torsemide. For thiazide-type diuretics, we have hydrochlorothiazide, chlorthalidone, metalazone, and for potassium sparing, we have amlodipine and triamterene. Aldosterone antagonists / potassium sparing diuretics, we have aldactone and Inspra. And for carbonic anhydrase inhibitors, we have Diamox. Thiazides and thiazide-like diuretics increase urinary excretion of sodium and chloride ions by blocking ionic reabsorption in the DCT. They also lower urinary calcium excretion, increase potassium loss, and necessitate potassium supplementation or potassium sparing companion medication. Thiazides also work for hypertension and kidney stone prevention. So thiazide-like diuretic, metolazone. Loop diuretics inhibit reabsorption of sodium and chloride in the proximal convoluted tube, DCT, in the loop of Henle. Because of their strong action, significant potassium leaves with urination. Potassium supplements help maintain potassium levels, and doctors prescribe both concurrently. Patients take loop diuretics early in the day to avoid excessive nocturia, which is urinating at night. So we already talked about Lasix, very common, a loop diuretic indicated for edema, hypertension, and pulmonary edema. Potassium-sparing agents work primarily in the DCT to inhibit sodium reabsorption and reduce potassium loss. Patients should avoid excessive potassium-rich foods and allow their provider to monitor potassium levels regularly. Osmotic diuretics inhibit tubular reabsorption of water by increasing the glomerular filtrate's osmolality. Doctors prescribe them for prophylaxis of low GFR acute renal failure. The only osmotic agent for edema treatment is mannitol. A urinary tract infection, commonly called a UTI, is either bacterial or fungal. It may occur in any part of the urinary tract, the kidneys, the bladder, the ureters, or the urethra. The most common UTI is caused by E. coli, acquired from the colon. A urethral infection is urethritis. Cystitis indicates infection, inflammation of the bladder, and pyelonephritis is an infection, inflammation of the kidney. Sexually transmitted diseases, STIs, also cause UTIs. Those with weakened immune systems have a greater risk, as do diabetics, because of elevated urine glucose levels. Symptoms vary but can include a painful burning sensation when urinating, fever, lack of urine output, cloudy or bloody urine, nausea and vomiting, and rarely confusion. And we have select agents for the treatment of urinary tract infections. Mostly antibiotics on there. Patients' infections acquired in hospital or institutional settings are non-scomial infections. Many non-scomial UTIs come from catheterization or cytoscopic examinations. Pyridium is a OTC and prescription urinary analgesic to treat UTI pain. One side effect is to turn urine an orange or reddish color, which technicians should note with an auxiliary label on the prescription bottle. So it is always good to tell the patient about this. Also, if they buy it over the counter, like Azo, to also inform them because it is kind of a little scary when you first go to the bathroom and it's such a orange or red color. So it's just best to let them know that that's a normal side effect. A common condition that affects millions of Americans is incontinence or overactive bladder. Older adults, especially women, are more prone to this condition. Women with multiple pregnancies may have this condition later in life because of pelvic muscles stretched during childbirth. Micturition is the medical term to describe urination. Although the bladder can store almost 1 liter of fluid, receptors trigger when the bladder is about half full and the urge to urinate begins. Even after urinating, a small amount of urine, about 100 ml, remains in the bladder. When a person coughs or sneezes, it can force the bladder to release a small amount of urine. This is called stress incontinence. Weight gain can intensify this condition. Urge incontinence is involuntary urination resulting from sudden, uncontrollable impulses to urinate. Table 23.5 lists select antimuscarinic medications for the treatment of urinary incontinence. We have oxybutynin for overactive bladder. You can see all the different brand names that are available, a patch, a topical gel, extended release, regular release. We have Detrol and Detrol LA, which is for overactive bladder and urinary urgency. We have Sanctura, which is for overactive bladder. Enablex for overactive bladder. Vesicare for overactive bladder. Toviaz for overactive bladder. Mybetriq for overactive bladder. Botox works for overactive bladder, among other things. That is an injection intramuscularly. And of course, we have the following sound-alike, look-alike drugs: chlorothalidone versus chlorothiazide, Bumix versus Buprenex, furosemide versus torsemide, and metalazone versus metoclopramide, ditropan versus diazepam.